Good afternoon, everybody. This is Congressman Mike Levin, and I want to thank you for joining us for yet another coronavirus town hall. Very grateful that you're here, whether you're watching us on Twitter or Facebook or YouTube or on our website at mikelevin.org. As always, on Saturdays, we are joined by a fantastic guest, Dr. Richard Garfien. Great to see you, as always. I'll briefly tell you about Dr. Garfien. He is an infectious disease epidemiologist, educator, and healthcare innovator who seeks to understand the causes of disease and translate that understanding into impactful solutions. He earned his PhD at Johns Hopkins University and his MPH at San Diego State University, and served as an epidemic intelligence service officer and epidemiologist for 7 years, actually almost 8 years, I think, at the Centers for Disease Control and Prevention in Atlanta, an agency that's just been in the news a little bit over the last few months. And then he joined the faculty at the UC San Diego School of Medicine in 2005. His research focuses primarily on airborne and bloodborne infections, often associated with health disparities in substance use, including tuberculosis, HIV, and viral hepatitis in the U.S. and abroad. His research on digital adherence technology over the last decade has informed the CDC and the WHO guidelines on the use of telehealth for remotely monitoring patients with tuberculosis. And such technology has relevance today, of course, for COVID-19 monitoring and patient support. Dr. Garfien, as always, it's great to see you.
It's great to be here, Mike. Thanks.
Thank you. Well, over the next 90 minutes or so, we're going to share the latest on the policy information with regard to COVID-19, as well as the public health information. There's a lot to talk about this week. As always, I'll remind our audience to ask a question. You can comment on the live stream, and I thank Ellen Montanari for monitoring those comments and trying to get them into the queue. You can also email us at townhallquestions@mikelevin.org. That email again is townhallquestions@mikelevin.org. I want to give a shout out, of course, to all of our staff for their help putting this together, our great campaign team, and of course, Jeremy for his work on the video conferencing. It has been another difficult week for the coronavirus in the United States. We have passed 88,000 deaths in the U.S. And as I've said before, I think it's important that we take the time to mourn those whose lives were lost. They're not just statistics. They are fathers and mothers and brothers and sisters, sons and daughters, colleagues and friends. And we need to mourn those families and mourn those loved ones each and every day as we consider the horrible human tragedy that this has taken on so many families in our community and in communities really all across the world. In total, the United States has the most confirmed cases by a lot, as you probably know. We're now over 1.4 million, in fact, closer to 1.5 million, 1,464,057, and 88,473 deaths. California has confirmed 77,515 cases with 3,166 deaths. San Diego County has confirmed 5,523 cases, and Orange County has confirmed 4,222 cases, 208 deaths so far in San Diego County and 86 in Orange County. You know, I want to thank all the community and nonprofit leaders that are going above and beyond. And Chrissy and I had the opportunity to go last week down to Vista to the North County Food Bank Distribution Center. They're doing an amazing job. And really so many people in our community that are going above and beyond. I'm incredibly impressed by our kindness and our generosity during this difficult time. And I understand everyone's frustration with the continued stay-at-home orders. It's a frustration that I share. I also obviously know how difficult this is for so many business owners in our community, so many that want to get back to work. And I think to get back to normal as quickly as possible, we need to listen to the experts. That's why we have one of them each and every week with us, Dr. Garfien. We've got to follow those public health recommendations so that we can get back to work safely. That's really the idea. You know, the sooner we do that, the sooner we'll be able to have some semblance of normal again in our lives. One of the big roadblocks to getting things back to normal and to getting open again is widespread testing. And the numbers being used in the state of California come from Harvard University. And the basic metric is you have to have enough tests to test 152 people for every 100,000 in a community per day. So in San Diego County and Orange County both have about 3.2 million people. That means you need a little bit more than 5,000 tests per day in San Diego County and in Orange County. San Diego County, I'm very happy to report this past week hit a record where they're now well over 4,000 tests a day, ramping up towards that 5,000 goal. They hit that a couple of days this past week. I wish I could say the same about Orange County. There were a couple of days this week where they were down like 400, 500. I think one day they were at 1,500. I did write a letter to the Orange County public health folks asking them, why was that discrepancy occurring? And that letter was signed by my colleagues from the Orange County congressional delegation. And I am encouraged that after that letter and after some of the reporting, which demonstrated that Orange County on a per capita basis was well behind not only San Diego County, but also Riverside County and Los Angeles County. They agreed to a meeting. We're going to be having that meeting this coming week, and I will be reporting back to all of you this during this town hall this upcoming week. So I look forward to that meeting. I think that at the end of the day, we continue to face two intersected crises, the health crisis and the economic crisis. We've said time and again, and we'll continue to say that you cannot have a healthy economy unless you have healthy people. The way we deal with the economic crisis and the astonishing numbers, 37 million now unemployed or on the unemployment rolls in the last 2 months, the way we deal with that is to deal with the pandemic. And so that's what we are committed to doing. And of course, we're doing a lot in Congress to try to deal with all of this. Just to recap, the first 4 bills, bipartisan bills that we passed, the first was at the beginning of March, $8 billion to help with the development of a vaccine. I'm encouraged by some of what I'm seeing with regard to our vaccine development. The second bill, the Families First bill, that was in the middle of March, that provided $200 billion for paid sick leave, emergency leave, nutrition assistance, and Medicaid reimbursement. The third bill, the CARES Act, which I'm sure you've heard about, $2 trillion, included a lot of money on the public health side, $100 billion for hospitals, a lot of money for our state and local government, but unfortunately not enough, about 150 billion, of which 15.3 billion came to the state of California, and over 500 million went to both the county of Orange and the county of San Diego. Unfortunately, none of the cities in my district received direct funding under the CARES Act because they're smaller cities. Only cities larger than 500,000 received direct funds. Also, $31 billion for education, about $20 billion for veterans. And then, of course, it had the Paycheck Protection Program, the initial $350 billion for that. It had the funding for our expanded unemployment insurance, extra $600 a week for 4 months. And then, of course, it had the direct cash payment of $1,200 per person making $75,000 a year or less, and $500 per dependent. We then passed an interim bill that was a $484 billion bill that included an additional tranche for the Paycheck Protection Program, another $320 billion, $60 billion set aside for smaller lenders and community lenders. It also included another $75 billion for hospitals and another $25 billion for testing, which included a mandate that the administration have a national testing strategy by May 24th for both antibody testing and standard diagnostic testing. And we're all waiting with bated breath to see that national testing strategy. We still haven't seen it from the administration. I think there's about 8 days to go. So we're waiting. Now, the latest thing that we did is we passed a fifth bill called the HEROES Act. Now, you probably heard about this. I flew back on Thursday. We voted on Friday, and I just got off a plane before this town hall about 2 hours ago. And I'm very grateful that I got back in time for this town hall. But when there are so few flights, the benefit of so few flights is there aren't as many delays. So that's a good thing, Doctor. But nevertheless, it is critically important that now that we have passed this bill in the House, that Mitch McConnell take it up in the Senate. I don't expect Mitch McConnell to agree with every word in this bill. It's a 1,800 plus page bill. There are things in there that I think shouldn't have been. There are other things I wish were in there that weren't in there. But what I do expect McConnell to do is I expect for him and for the Senate to offer their solutions for our state and local governments and for all the rest, the frontline workers that we offered in the HEROES Act, and let the Democrats and Republicans in the House and Senate come together for the fifth time since this pandemic started, and let's do something that we can be proud of for the American people. Now, what's in the HEROES Act? So critically important. Nearly $1 trillion for our state and local government. When you look at what it means for the state of California, we're talking about $21.5 billion in 2020 and nearly $26 billion for 2021. Remember, in California, we went from a surplus pre-pandemic of $21 billion, and now the governor says we will have a deficit of $54 billion. This would be huge for the state of California. Of that money, Orange County would get roughly $1.8 billion. So $1.2 billion in 20 and $600 million in 21. Similar numbers for San Diego County. And for my cities in the 49th district, which includes both North County, San Diego, and South Orange County, we are talking over $300 million directly to Carlsbad, and Oceanside, and Vista, and San Clemente, and San Juan Capistrano, and all the other cities. And I can tell you that our mayors, whether they be Republican or Democratic, they need that funding. Our frontline workers need that funding. So critically important to keep our police officers, our firefighters, our nurses, our teachers, all continuing to work, not only during this pandemic, but in the months and years after the pandemic. We've got to get our local government and our state government on solid financial footing. Mitch McConnell, you might recall, he said, let them go bankrupt. Then he said we need to take a pause, but the pandemic is not taking a pause. This emergency is not taking a pause. We have to do all we can to respond. There's also a $200 billion HEROES Fund in the HEROES Act. It's hazard pay for frontline workers. It protects Americans who are losing their employer-provided health insurance with COBRA and with a new open enrollment period for the Affordable Care Act. It requires OSHA to issue a strong enforceable standard for all workplaces to implement infection control plans based on CDC expertise. And it prevents employers from retaliating against workers who report infection control problems. And another $75 billion for coronavirus testing. We just talked about the importance of testing. This bill provides $75 billion for testing, for contact tracing, and for other measures to ensure that every American can access not only free testing for COVID, but free treatment for COVID. So important. And it includes another stimulus payment, another $1,200, because we know that $1,200 once was not enough for most Americans dealing with this pandemic. It expands the unemployment through the end of the year, and it provides a direct appropriation of nearly $1 billion to fund child and family care for essential workers. It also addresses rising hunger by providing nutrition assistance, an additional 15% increase to the maximum SNAP benefit, $175 billion in new funding to assist renters and homeowners make their monthly rent, mortgage, utility, and other housing-related costs, $25 billion to save the United States Postal Service. And I take that personally with over 100,000 veterans working at the United States Postal Service. As I chair the subcommittee on veterans employment, we've got to make sure that we have a solid financial footing for the Postal Service. $100 billion in additional funding to support the educational needs of states. And that includes all of our K through 12 schools and our higher education institutions. And I've spoken to every superintendent just about in our district, and they desperately need that funding. Also resources for a safe election system, an accurate census. And I'm pleased that some specific provisions in the HEROES Act included my bill that we introduced in the Veterans Affairs Committee recently to help military families terminate new leases if they're impacted by the Defense Department's stop movement order, because nobody that is serving their order, doing their duty, should be penalized as a result of that. So that language was included word for word. I'm very hopeful, by the way, that that provision and many of these other provisions are going to be in that final piece of legislation when the Senate and the House work together. So along those lines, it's time, as I said, for Mitch McConnell and the Senate to act. And I don't expect him to agree with every word, but I do expect him to act. So that's what we need, and we need to make sure that he gets that message loud and clear. Finally, as I mention every week, I've been saddened to hear stories of increased domestic violence during COVID-19. I encourage anyone in need of help, call or text the National Domestic Violence Hotline at 1-800-799-SAFE. That number again is 1-800-799-SAFE. We have a ton of questions this week, Dr. Garfien, and you told me just before we got on, go straight to the questions. So that's what we're going to do. By the way, if you have questions, please, again, email us at townhallquestions@mikelevin.org. And I'm going to go straight to the questions. First, we've got one from Jen in San Clemente. And Jen asks, can you address enforcement of social distancing and other standards for restaurants that have definitely opened for dine-in? Well, I've said this before and I'll say again, I trust our local law enforcement agencies to do what is right and do what is best. I've had multiple conversations with them in recent weeks, and I think they have a tough balance that they are trying to figure out right now. I think it's very clear what the rules are. The rules say that you can have takeout and delivery, of course, if you're a restaurant, but we're not supposed to do dine-in at the moment. I would hope that local officials are going to address any situation where those rules aren't being followed. And I hope that most business owners will adhere, or all business owners will adhere to those rules because they are really important. I'm going to go to a few questions for Dr. Garfien. It looks like they're about contact tracing. So here are the questions. I'll ask all three of them, and then you can respond to all three of them collectively. We do that a lot in Congress sometimes. We get multiple, that's how you get through more questions.
Okay.
So Nancy in Vista asks, are Orange and San Diego counties using public health graduates or MPH to do contact tracing? A similar question from Adele in Solana Beach, who added, is there contact info for those of us who may wish to volunteer in this public health endeavor? And then one more question about contact tracing from Lori in San Clemente. Does contact tracing require in-person contact, or can it be done remotely?
Well, these are great questions, and I'm glad people are thinking about contact tracing now because we're starting to move into that phase in the epidemic, and it's good that people are aware of it. So let's see. Let's start with the first one. Are public health students from in San Diego or Orange County involved in the response? Well, I can say yes. For San Diego County, the health department is planning to take advantage of the amazing students and graduates of the MPH programs at both UCSD and San Diego State University. And I know that our MPH students are chomping at the bit to be able to participate. I mean, this is exactly why people go into public health, is to be able to help out in times like this. The objective of public health is to prevent these kinds of outbreaks, but once they're happening, our jobs is also to help to control them. So the protocols that are being written right now are based on guidance that we've received from San Francisco, Massachusetts, Ohio. They've got some protocols that are a little bit further ahead than ours are in San Diego, but I've been in communication with our county health department and have been helping out with the development of the protocols. And I know that they're moving along, and we're anxious to get started quickly. The county has already been hiring staff, and there's a plan to hire many more. In Orange County, 75 health investigators have already been working on contact tracing, from what I understand. And I haven't heard whether or not the public health students from UC Irvine's MPH program are involved, but I'd be really surprised if they weren't. Just another note on the contact tracing is that Governor Newsom has called for California to recruit 10,000 contact tracers throughout the state to work in the 61 local health jurisdictions. And their job is going to be to call every person who's newly infected with COVID-19 and then ask that person who they've been in contact with in recent days, and then reach out to those people and tell them that they may have been exposed to the coronavirus. And then that way, those people who've been notified can stay self-quarantined in their homes for 14 days until they either develop the disease or they don't. And this 14-day period, that's the window period for the incubation period for the disease. So if they stay away from other people for that period of time, then they won't transmit the virus to other people before they realize that they're infected. And just so people are aware, contact tracing involves informing contact that they may have been exposed to the virus, but the contact tracers don't give the names of the case to the contacts. Oftentimes the contacts know who that person is because they know of somebody who's been sick, and that helps with the contact investigation. But the contact tracers from the county don't give out names. It is confidential, which leads me then into Adele's question, where she asked whether or not contact tracing is confidential or if she can get involved with contact tracing. And Adele, the process of contact tracing involves a lot of confidential health information. So only people that are actually hired by the county or its partners are able to assist directly with contact tracing. They go through a vetting process. They're trained heavily on ethics and maintaining confidentiality. And so it's really there to protect everybody. So as much as I'm sure they would love to have help in doing the contact tracing itself, there is a hiring process that's involved. However, I love the fact that you're interested in volunteering. I think that's fantastic. And the more of that we have, the better. So I did a little hunting and I found out that San Diego County has a volunteer coordinator that will coordinate efforts for anybody that's interested in volunteering. And their website is COVID-19-volunteers at San Diego County.ca.gov. Or if you were just to Google COVID and San Diego County, that link is at the bottom of their webpage. And then I also found out that the state has a volunteer website where you can actually put in your zip code. And so you might be able to find some opportunities in Orange County. And their website is www.californiavolunteers.ca.gov. And that would be a great place to find some information. And then as far as Lori's question, does contact tracing require in-person contact or can it be done remotely? All of the contact tracing that's going to be done currently is by phone, primarily contacting people by telephone, although text messaging, emails, U.S. Postal Service will also be used as alternative ways to get in touch with people if we can't get a hold of them by phone. So, and that's being done intentionally to avoid person-to-person contact.
And I know that a lot of the training itself is being done online. Isn't that right, for the contact tracers?
Yeah, there's some really great materials online from some of the other health departments that have already worked ahead of this. And believe it or not, there are organizations that have been doing contact tracing for things like HIV and Ebola and sexually transmitted diseases around the world. And so there's a lot of experience in doing contact tracing. It all has to sort of be customized for coronavirus because the incubations period, the route of transmission is a little different. But these protocols are being developed and we've got a lot of good models to work off of.
So it'll be very interesting to see in the weeks and months ahead kind of how this materializes. I know the state has a goal, I think, of 12,000 is what I remember.
Yeah, I read 10,000, but I had read 12,000 before that. I think that's actually the right number.
And we had Supervisor Fletcher on a couple weeks ago, and he mentioned, I think San Diego has a goal of 500 to 700 within San Diego County. I think they're looking to ramp up pretty quickly from my understanding. I'm sure a lot will be from UCSD.
Yep.
Very good. All right. Next question is from Ann on Facebook. Ann says, it seems like a no-brainer to limit large companies from qualifying for the small business loan. Well, I agree with that one, Ann. Was it an error in writing the bill or was it a negotiation in order to get the bill passed or something else? Well, I think you're referring to the original CARES Act. The initial CARES Act had the $350 billion in the Paycheck Protection Program for small businesses and define small businesses as 500 employees or less. And what we realize is there are a lot of businesses out there that are divided into multiple, whether it be restaurants or hotels or others, multiple corporate entities, each of which is less than 500. And then of course, we've seen things like the Los Angeles Lakers basketball team, where technically they had fewer than 500 people. And so obviously you had some very well capitalized businesses whose CFOs looked at this and said, hey, that's a good deal and we can qualify, so we might as well go for it. Of course, we never expected that would occur. I think sometimes you can't anticipate everything that will happen. But when this was crafted, it was a very bipartisan process, and the PPP part of it, the initial concept was actually Senator Marco Rubio from Florida, and we realized there were real problems with that program. So we did a number of things. First, we said if you want additional funds for the PPP, we've got to set aside a significant sum, and we landed on $60 billion in the interim bill. The $484 billion bill contained another $320 billion for the PPP, for the second tranche, of which $60 billion was specifically set aside for the community lenders and the small lenders. That money has been borrowed very quickly again. There's about $100 billion of capacity under the second tranche of the PPP, but it's for the bigger banks, which tells me there's still a appetite for truly mom and pop businesses to be able to have some sort of facility to be able to get through the pandemic. And there are a number of proposals that are floating around. One of them would provide direct grants to a certain category of businesses of 20 people, 20 employees and under. The HEROES Act would have made or does make changes as it stands to the PPP to set aside, I believe it's 25% of the loan funding for businesses of 10 employees and under. So I think we will see in our negotiation with the Senate some sort of additional set aside for truly mom and pop small businesses. The other thing that's happening is we created a select committee on the coronavirus crisis, chaired by Jim Clyburn of South Carolina, with the goal of oversight as well as weeding out any waste, fraud, or abuse as to how the money is spent in the CARES Act and the Families First Act and in the interim bill, which between them are about $3 trillion worth of coronavirus-related spending. And the first thing that the committee did was they wrote letters to some of those more well-capitalized small businesses that technically meet the SBA definition of small business. They're less than 500 people, but nevertheless are not who we were intending the money to go to. And the letters basically say, you are not our intended recipient of these funds, and we ask that you return it. And most of these businesses are adhering to that request and are returning those funds. So we'll just keep at it. We're going to continue to do all we can to provide oversight for the money that's already been allocated, as well as to try to limit the small business lending to truly small mom and pop businesses that need the money the most. Mary, who is a former Carlsbad resident, asks, why has Congress not challenged President Trump's isolationist actions, such as cutting off funding to the World Health Organization and terminating NIH cooperative research with China? Can Congress do anything to prevent U.S. isolationism? Well, I worry a lot about the isolationist tendencies of this administration. I worried about it before the pandemic, and I worry that the pandemic is only exacerbating the isolationist tendencies. I think we have opposed a number of these measures, whether it be the trade policies and the tariffs that have been imposed, which have ultimately hurt American businesses and American consumers. I am very concerned about the direction that we're taking with regard to the World Health Organization. And I think we have to cooperate effectively on hopefully restoring back to our position as a leader the world over with regard to this pandemic, because I think that the United States of America has always played a very important leadership role in global affairs. And I worry that we're in our quest for isolationism, we are forgetting about the important role we play as a leader the world over. And I think we're going to have to continue to hold oversight hearings in the appropriate committees of jurisdiction to understand exactly what's going on with regard to our role in the World Health Organization, our role to try to provide some kind of global cooperation for the pandemic response. Here's a question for Dr. Garfien, and it looks like it was asked by two people, relatively similar questions, Jenna in Orange County and Janet in San Juan Capistrano. How long can the virus live on non-porous surfaces versus porous surfaces?
Yeah, this is a good question, and it keeps coming up. Unfortunately, there's not a really good solid answer, but what I can say is that the most rigorously controlled study to date indicates that the infectious virus can survive up to a day on cardboard and up to about 3 days on plastic and stainless steel surfaces. I just want to note that these are under ideal laboratory conditions. What actually happens in nature, and depending on the amount of the inoculum of the virus onto those surfaces, that can vary. It also can vary depending on the environmental conditions, the heat and the humidity, where that material is located, things like that. But that's a pretty good guideline to go by, and that's what most people are using right now. Also, if you ever hear of some different numbers when it comes to how long the virus survives, keep in mind that some studies were done where they looked at the viral RNA or the genetic material from the virus, and it's been detected. Now, that viral RNA doesn't mean that the virus is actually still intact and can cause infection. That would be looking at the viable virus. And so when you're reading some of these numbers, it's important to see if you can pick out whether they're talking about just detecting the viral RNA versus they're detecting active virus. So, but in terms of the question of porous versus non-porous, there isn't a whole lot of research that I've found that talks about the virus survival on cloth surfaces, like on a cloth mask or on clothing or things like that. So it could kind of depend. I think it would certainly be somewhere in between, maybe the duration of time on cardboard versus a non-porous surface like plastic or stainless steel. The good thing is, though, is if you're worried about clothing or masks or bedding, all you have to do is put it in the wash, so a normal load of wash with the regular amount of detergent, and wash it and then throw it in a hot dryer when you're done. That does a great job of inactivating any virus, not only coronavirus, but other the flu virus and common cold viruses. It works really well. So, general rule is if you can wash it, that's the best thing to do. Try to disinfect it. If it's a non-porous surface, you can use standard disinfectants, alcohol, bleach, disinfectant wipes, that kind of thing. If it's porous and you can wash it, that's what I would recommend.
Well, doctor, you'd be very happy with me. As soon as I got back from the airplane, the dirty clothes, straight to the washer, put it on hot. Hopefully didn't wreck the clothes, but we'll find out.
Great advice, Mike. That's a really important point. For healthcare workers, when they come home, the first thing they do is put all their clothes in the wash, take a shower, and that's a good way to protect their families.
Well, in this instance, it was Chrissy pointing at the washer dryer. Happy wife, happy life.
There you
go. Here's a question, and it looks like it's for both of us, from Diane in Oceanside, who asks, can we find out how many COVID patients are in each nursing and assisted living home? We have so many here in North County, San Diego. Well, Dan, my understanding is there are privacy concerns around that. I think HIPAA and other restrictions around knowing personal data, that is a factor. But I think it's important to know how many cases we have in local nursing homes generally. Anything you'd like to add to that, doctor?
Yeah, sure. It's true. We have to be very cautious of disclosing personal health information for both for the patients and for the healthcare workers that are working in those skilled nursing facilities. But the California Department of Public Health also realizes, just like restaurants and other public businesses, the public has a right to know if there are risks. And that's why they put the grade A's and B's on the restaurant windows after they do inspections. the California Department of Public Health has a website that lists all skilled nursing facilities in the state by county and by name. And so you can look them up and you can see if a skilled nursing facility in your community is on that list. 56% of the facilities in California have reported to the CDPH so far. And by my quick back of the hand calculations, it looks like there's 71 of these facilities in Orange County and 86 in San Diego. And both of them have about 12%, 12 to 13%, that have reported that they've had cases either among their patients or their healthcare workers who work in those facilities. And so it's not as bad as what I've heard from other parts of the country, but there are definitely, these are real hotspots. Unfortunately, if somebody does get coronavirus in a skilled nursing facility, the people that are the residents are really at the highest risk of severe disease. So it's very, very important that the health department knows about these infections and responds and tries to improve the working conditions and the living conditions in these facilities to make sure that they're safe.
So along those lines, you may have seen, I know that the state of California is developing its testing criteria, and I think they want to, as we move beyond symptomatic COVID patients to more asymptomatic people, I think they're focused on nursing homes as the first place where they want to test a lot more people, right? And hopefully that'll happen quickly, I would hope.
That would certainly make sense.
So I've seen a lot on nursing homes, a lot on the prison system, a lot on our food processing facilities. It would make sense to me that to the extent we have more capacity in our diagnostic testing, that we would want to move into those communities that are highest at-risk individuals, and that's what I'm going to be pushing and advocating to see happen as we move forward in the weeks and months ahead. Here's a question from John in San Marcos. John asks, may I suggest this idea, or it's an idea, it's not a question, to help the citizens affected by the COVID-19 pandemic. Allow us to draw money from our IRA SEP without penalties and tax-free, and not require us to pay it back into those retirement accounts. That would provide some security for many in your district and across the country. Well, I know that in the CARES Act, there is a provision where you can take up to $100,000 out of your retirement account without the 10% penalty. I'm certainly not advocating or recommending that for anybody, but that is in there for people that have that amount of funds or those assets in a retirement account. I'm always very wary of doing anything to recommend jeopardizing anybody's retirement. I know there are some desperate situations out there, and that provision for the $100,000 without penalty, you still have to pay taxes on it, but and it's going to be at your ordinary income rate. But nonetheless, you don't have to pay the 10% penalty on the $100,000 that was included in the CARES Act. Here is a question for you, Dr. Garfield, from Susan in North County, San Diego. Susan asks, have they traced and found any people protesting at the beach 2 weeks ago who now have the virus?
I think that's a really interesting question, and I think a lot of people might feel some gratification knowing that people who broke the social distancing rules paid a price. But unfortunately, people who attend protests are not registered unless perhaps they're arrested. So there's really no way of knowing who attended these events to see whether or not that led to infection subsequently. There was some data that Governor Whitmer from Michigan says, where some researchers looked at geofencing analysis in their community, which does show that there's a correlation between protesting and an increase in cases. If people choose to protest, that's an American right, and I would just say that if they're doing so, they should still practice social distancing, wear masks, and protect each other. It's one thing to get your opinion out there, but it should be done in a safe way.
I certainly agree with that. Gary in Ladera Ranch asks, is there any pressure that Congress can put on states, counties, or cities to reopen in a safer schedule? Well, pretty much everything I'm trying to do in Congress is directed towards helping our cities, our county, our state, and our communities get back open safely. And, everything from, funding for states and cities, trying to ensure that they have the vital services that are necessary, law enforcement, fire, nurses, teachers, trying to make sure that we have enough testing, trying to get the administration to finally provide a national testing strategy for both standard and antibody testing. All of that is geared towards reopening safely. We all want to reopen. We just want to reopen safely. And so I think everything that we're trying to do, that I'm trying to do specifically, is with that objective in mind. Here's a question for Dr. Garfield from Sherry in Oceanside. She asks, I'm concerned about the 3 children who died in New York. I assume she's talking about the new disease that looks like, what is it called? Kawasaki syndrome, I believe it's called. She asked, do you have any more information on what's happening? Is it safe for kids to do a small limited soccer practice, just 4 kids and the coach, with the kids only using their own soccer ball? Ooh, that's my 7-year-old, I think, would like that.
Yeah, well, it's sad news to hear that there are these children that are developing a newly recognized form of coronavirus. It's called the pediatric multisystem inflammatory syndrome. And basically, it's a post-viral syndrome that causes an overreaction of the immune system that can lead to blood vessel damage and inflammation. And so it can affect all the different organs in the child's body. And they've identified over 100 cases in New York City now in kids. 3 of them have died, unfortunately. And the disease presents similar to Kawasaki syndrome. Kawasaki syndrome is another viral infection that leads to a rash and fever and general malaise in the child, but it has been shown to actually affect the child's heart, and so it can result in some lifelong heart damage with the way it affects the blood vessels. So it's not the same disease, but it presents in a similar way. And the one thing to point out is that although this is newly recognized, the number of cases that we're starting to see now doesn't necessarily reflect a change in the coronavirus disease or a more virulent strain. It just means that we're recognizing these symptoms as a new presentation of coronavirus, and doctors are looking for it. And so we're going to start to see more of it. But I think what it does is it sort of reminds us that although children seem to have a lower risk for severe disease of coronavirus, it's not zero. They're not invulnerable. And so when people think that, kids are going to be fine if they all go back to school, I think that for the most part they will be, but there's going to be some kids that are going to get really sick. So we can't ignore that. So soccer. This is a good question. I get asked questions about can the little league teams go back to playing because they're just standing apart in the fields and they don't really get in contact. Same with soccer. I think right now social distancing orders in the county still prohibit group activities like sports. If they're family members and they go out and they play together, that's fine because they're all part of that family unit. If you start to mix family units, then I think what you really have to think about is, can you do this safely? Theoretically, if the kids are playing together, they're staying 6 feet apart, maybe even a little bit further apart if they're breathing hard, and avoid touching the ball with their hands. It is soccer, so you shouldn't have to, unless you're doing throw-ins, you shouldn't be touching the ball. And if you do, touch the ball and each other for whatever reason, now consider that your hands might be contaminated, and so you don't, teach your kids, don't touch your face. Keep your hands out of your mouth and nose and face, and that can be hard to do if you're sweating. When they're all finished, they should wash their hands or use hand sanitizer, and also keep into consideration, if you're driving to the field, it might not be a good idea to be carpooling with other people's kids at this point. And if you do have to drive with somebody else that's not part of your family unit, you should be wearing masks. So I'm not recommending that this is the way to do it, but I think people can sort of look at their personal situations, really understanding we're talking about an airborne infectious disease that can also be transmitted through fomites, like, touching a ball. And if you really feel like you could do this safely without there being any transmission, that's a choice that you need to make. But if you have any concerns about people gathering and maybe the kids are too young and they can't really figure out how to do this safely, then maybe that's not the best thing to do.
My son's going to be crushed. No.
Tell him to play with his sister.
Eric in San Juan Capistrano asks, we have been asking for more testing for 2 months in the OC. Meanwhile, in LA, anyone can get a test that wants one. What's going on? Well, I know the policy is anyone in LA can get a test that wants one. Whether or not that's the case or not, I think we'll have to see. I have been troubled that the number of tests in Orange County has trailed the number in San Diego County and in Riverside County and in Los Angeles County as a per capita number. And I've tried to understand why that is. And so, as I mentioned, we've requested a briefing. And by the way, we've also said we'd like to help if there's anything we can do, if it's more funding, if it's helping in any way we can to connect the dots with any federal resources that we can bring to bear. And so we're getting that briefing this coming week from the public health folks in Orange County, and we'll certainly keep you posted. Again, it's my hope that we can reopen in a safe manner, consistent with the state's guidelines as quickly as possible. And obviously, more testing is central to being able to do that. Here's a question for Dr. Garfien from John in Laguna Niguel. John asks, now that golf courses are open with some playing restrictions, do you think it is safe for those of us over 70 with no underlying health issues to play?
Yeah, well, physical activity is important during this time, both mentally and physically. And so the more exercise we could get, the better, especially if you can get outside in the nice sunny weather that we've been having. I have a friend who's an avid golfer, and he described his latest experience to me at Torrey Pines. He said they have placed restrictions. They have one person per cart unless they're part of the same family. They wear masks when they check in and they're around other people. They've actually removed all the ball washers and the rakes from the bunkers so that nobody's, picking up anything that somebody else has touched. And they've actually raised the bottom of the cup so your ball doesn't go all the way down. It actually sits just about an inch or so below the hole, so you can pick it up without actually reaching your hand in, and you can't take the flags out. So I think, the golf courses have really thought this through. They've really, said, we understand how it's transmitted. People are outside walking and staying far enough apart. It should be done safely. They've made this effort. I think, if the more businesses that can do that, the quicker we'll sort of get back to normal. And I think that all of us have to do our part to make sure that we're, when we go into those environments, we're abiding by the rules and we're being safe. Now, in terms of, somebody who's at high risk for severe disease, I think it's important to really take maybe some extra precautions. It's upon those people to really be aware of what their risks are and to protect themselves as best they can. Bring hand sanitizer with you, clean your hands more frequently, avoid, if you see that you're coming up on a crowd, make the effort to sort of avoid them if possible. Don't hang out in the parking lot visiting with your friends, as much as I know we all want to do that. Those are the things that can put you at additional risk. So, be aware, be smart. And I think, these are things that people can actually start to go back to doing.
Excellent. All right. Good to know. Carol in Oceanside asks, since it appears that the Republicans will prevent us from having mail-in ballots for the November election, how can we go about convincing the individual states to implement voting by mail? Well, we included national vote by mail in the HEROES Act. That has passed the House. I know that'll be negotiated between House and Senate. I know where Mitch McConnell stands on that. I think the premise is very simple. No one should have to risk their health in order to exercise their right to vote. That should not be a controversial statement. That should not be a partisan statement. And I want to avoid what happened in Wisconsin, where you had people waiting in a dangerous situation. And I think we've had multiple cases of COVID from people in Wisconsin that believe that they may have transmitted or had the disease transmitted to them on or around that day. So I don't want to see that ever happen again. And that's, I think, all we've said. At the same time, I'm encouraged to live in California, where we already have a district that has widespread vote by mail. Everyone will have the opportunity to vote by mail in the district. That's already the case in Orange County, where everyone receives that ballot in advance and can mail it in or drop it off at a vote center or at one of the drop-off boxes leading up to the election, the 10 days prior to the election. I think a similar thing will happen in San Diego County and eventually throughout California, and I think that's good. And I would just encourage that basic premise: no one should have to risk their health in order to cast their vote. Here's a question for you, Dr. Garfield, from Christine in Vista. We need social distancing guidelines for friends and family. What do you recommend? Ooh, that's a good one.
Yeah. Well, my first recommendation is review the CDC and local health department websites. There's really good guidance on there about how to prevent transmission and what to do if anybody is infected. I think specifically when we talk about friends and family, these are situations where we can be a little bit more relaxed. So for families where the family unit stays together and avoids contact with others, we can pretty much go through our normal life together at home without taking any extra precautions. I mean, just like you would normally do to avoid spreading the flu or a cold or anything else. Obviously, good hygiene is important. But be aware that if somebody in the household does become exposed or even infected, then that individual needs to self-quarantine so that they don't infect the rest of the household. And if it's a person who was exposed, maybe they went to the market and they found out later that somebody there was infected, or they get a call from the county that says that they've been exposed, then what they need to do is self-isolate in a different part of the house, preferably have their own bathroom, avoid contact with the rest of the household. And if they actually do get infected and have the disease, then you have to be even more careful about staying isolated, not to expose anybody else in the house. And when it comes to friends, this is kind of a tough one because it kind of goes back to that old sexually transmitted disease slogan that we used to say, is that, the person you're sleeping with, when you sleep with somebody, you're sleeping with the people that they've slept with and the people that those people slept with and the people that those. So, if you have some friends and you're a very tight pod, you're both very tight pods, nobody's, being exposed outside of their families, then the risk of somebody within those families being infected is low. And maybe there's it would be safe to get together in a socially distant way. But if, those family members are, intermixing with other families who are mixing with other families, then you kind of get into a slippery slope of, is somebody really infected or has been exposed? And, just keep in mind that if you become exposed, now you're talking about, 14 days of self-isolation, and that's not an easy thing to do. And so it's worth thinking about to avoid that.
Definitely. Thank you for that. Lori in San Clemente asks, I heard on the news that the U.S. has no national plan for tracking antibody testing. Does California have a unified plan? Yes, California does have a unified plan that was announced beginning of April. Public-private collaboration, both for testing and tracing. As we said before, they have a goal on the order of 10 to 12,000 contact tracers in place. And they also want to adhere, the state of California wants to adhere to the 152 tests per day per 100,000 people. And so I know California is on its way. I think we're testing 30 to 35,000 a day statewide. We want to be at somewhere between 60 and 80,000. As I mentioned before, at the national level, by May 24th, so just about a week from now, by virtue of our having passed that interim $484 billion bill, there was $25 billion for testing, but specifically there was a mandate, and it was a sticking point. It was something the administration did not want in the bill, but it's law, which is that they have to develop a plan, present it to the relevant committees of Congress, both the House and the Senate, that outlines their plan for the standard diagnostic testing and the antibody testing. And that also includes contact tracing as well. And in the HEROES Act that we just passed, it further expands upon that concept and says that they have to update that plan and present it again to the Congress by June 15th. So assuming, if nothing else, we're going to have that May 24th deadline, and they're going to need to get us that plan. I think it probably will not, the timing probably will not work out where we get an update by mid-June. But just know, I bring all that up just because we're very cognizant of that in Congress. We desperately want to see a national testing strategy, and I'm grateful to the state of California for leading where the administration at the federal level has not when it comes to a comprehensive strategy on testing. Here's a question for you, Dr. Garfien, from Joya in Ladera Ranch. She asked, there have been no directives around neighborhood pool use. And I have heard some HOAs in South Orange County are permitting their residents to use the pools again. I've heard the same, by the way. I feel like the issue is less the pool and more the social distancing while at the pool. What are your thoughts on safely reopening our pools and what might that entail? And the questioner doesn't know this, but I actually have a pool in my HOA, so I'm very interested in this question.
Yeah, that's a super important question now with the weather warming up. So according to the CDC, there's no evidence that the virus can be spread to people through water in pools, hot tubs, spas, or water play areas, because proper operation and maintenance, such as disinfection with chlorine and bromine of these facilities, would inactivate the virus in the water. So a properly maintained pool is safe to go into the water. But Hoya makes a really good point, which is about the social distancing while you're at the pool. Although the virus might not survive in the water, there's potential sources of infection outside of the pool, such as using a bathroom, a locker room, pool furniture, floaties, touching the rails on the pool. I know, when I'm in the water, when I get out, the first thing that happens to me is my sinuses drain everywhere. And so if that's on the pool deck or on a towel or something,
I'm staying away from you when you get out of the pool, doctor.
Hey, we all do it.
That's right.
And so, there's that potential for transmission. And remember that the virus can survive on surfaces for hours to days, and proper precautions need to be taken for disinfecting of those surfaces. So, if the HOA wants to open up the pool and they have the lifeguards and the pool maintenance people making sure that the water is, that the chlorine levels are appropriate in the pool, that they're wiping down surfaces like, it might even be a good idea to take away the pool chairs for now so that people aren't hanging out. It's one thing to go in the pool and play, and when you're done, get out and, go home. That seems to be reasonable. But I think it's really important for all of us who are going to use those facilities to recognize that just because it's open doesn't necessarily mean it's totally safe. So you have to use a little bit of personal judgment there and think about what you and your kids are being exposed to. So although there are some of these restrictions are being lifted and some HOAs are starting to open up these pools, I think it's important that we make good decisions for ourselves and our families. If people are more interested in learning more about that, USA Swimming has useful information on their website about reopening pools and maintaining social distancing while you're exercising in pools that I highly recommend.
By the way, I would, if my team is watching this, Hunter, if you could add these links that Dr. Garfien is referencing to our resource page at mikelevin.org, backslash COVID-19, I would be very grateful. So hopefully we can, Dr. Garfield, hopefully you've sent all these to Ellen or Hunter, and we can make sure we get them all up on the website.
You bet.
Thank you. Julian in Dana Point asks, what message do you have for the city council in your district that sided with outside groups to sue the governor over his recent beach closure order? They demanded unsuccessfully an immediate temporary restraining order, reopening local beaches pending the hearing of the case. Well, my first thing would be, I hope that we can work this out. And, you know, I know from my discussions with both the mayor and with the governor that I think everybody at the end of the day, I hope, can get on the same page, which is we want to reopen, but we want to do so safely and responsibly. My other message is I hope that we can provide some assistance with regard to help filling the horrible revenue gap that this has left, whether it be the city of Dana Point or all of our cities. I think I am very mindful of the toll this has taken on our municipal finances. So I guess that would be my twofold message. I hope that we can work it out between state and city, but I also hope that we can be, as the federal government, we can be helpful to our cities and that we can provide the assistance that they need to get back on solid fiscal footing to prevent the loss of any jobs or any cuts that they would have to make to essential services. Here's a question for both of us from John in Carlsbad. Number one, it's a two-part question. Number one, once a vaccine is developed, who will decide who gets it first? Oh, that's a great question. I have that same question. I would guess that health providers and first responders would get it first, but after that, will Medicare pay for the vaccine and the administration of the vaccine? Should the government provide it to everyone free of charge and pay all providers who administer it, regardless of an individual's insurance coverage? Number two, after a vaccine is available, will a, quote, proof of vaccination card be required for domestic and or international air travel? Could such certification be linked with our passports and real ID driver's licenses? Really interesting question. Very briefly on the policy side, I think it absolutely should be free and readily available. We've got to be very, very careful that it's not only available to the wealthy and well-connected. Particularly given the high risk that the virus has demonstrated in certain communities that historically have been underrepresented with healthcare. I'm deeply concerned about the rate of infection among the uninsured and the fact that people are going to get stuck for huge bills that they can't afford when time comes for treatment. So we have free testing. We got that as part of the Families First bill back in the middle of March. But in the HEROES Act that we just passed, it includes free treatment as well. And the administration said that they would reimburse, Medicaid would be reimbursed for covering treatment or for those who are uninsured. But I think we need an open enrollment period under the ACA, and that's what's provided in the HEROES Act. In terms of the proof of vaccination, obviously we need to look into that there's a lot of different ethical considerations there and other considerations. But doctor, what do you think of those two questions, both the who gets the vaccine first and then the proof that you're vaccinated?
Yeah, these are really excellent questions, and I'm glad people are asking because it's important. And I really hope that our leadership steps up and puts together a plan long before we actually have a vaccine. We can't be deciding who's going to get a vaccine after it's available. That plan should be in place now. And we've seen what's been happening with the testing plan and the implementation of that and some of the problems with that. So I hope we don't make the same mistake with the vaccines. Vaccines are typically distributed to public and private healthcare facilities for administration. So once they're available, they get sent out to healthcare facilities, and then they have certain criteria for disseminating them. And then as more vaccine becomes available, it can be broadened out. And I think that the caller is correct in thinking that most likely it'll go to first responders and frontline healthcare workers initially to make sure that they're protected and safe so they can take care of the rest of us. I would think that another high priority group would be anybody that's at high risk for developing severe disease, such as the elderly and those with underlying health conditions. Going down from there, I think there's a lot of essential workers that need to be vaccinated to make sure that they can safely return to work. And that could even include people like waiters in restaurants and people that work in supermarkets and people that are working in manufacturing and in, food provision industries. And eventually it will become more and more available and more of us will get it. But I think we need to take care of the high priority individuals first. As far as payment, I think, Mike, you're right. For most people, I think their insurance will cover it. And however, I haven't heard any word from Medicare yet as to whether Medicare is going to be covering the vaccine. And I think this is really important for the administration to, figure out what that plan is going to be. While there's been some examples in the past of situations like this, like the H1N1 flu, where it's a new vaccine that had to be distributed to the whole country in a very short period of time. We have some experience with this now, and so we're not starting from scratch. But I think that plan hasn't been fleshed out yet for coronavirus, and I think that really needs to be a priority. This other question about the proof of vaccination, or what some people are calling the immunity passport, is a really interesting one. On the one hand, it makes sense. So an immunity passport is basically if you have the disease and you've recovered, so potentially you have immunity, or you get vaccinated, then you get sort of a pass that will allow you to go back into the community because you're not at risk of becoming infected or infecting anybody else. That's the theory behind it. The problem is that right now we don't have enough evidence to know whether or not antibodies are protective against the reinfection. And if it is, we don't know how long that lasts. I mean, this virus has only been with us 6 months, at the longest that we know of. And so to say that it's going to provide protection any longer than that, we really have no experience. And so it's going to take some time to figure that out. Plus, we wouldn't want to get that wrong. If you have an immunity passport and it turns out that, it's not 100%, well, then you might be giving people this false sense of security and they could be putting themselves and others at risk. And then the other thing that I think you mentioned that's really important, Mike, is the ethical consideration. Who is it that would not have access to this passport? So if you don't travel internationally, you don't have a U.S. passport, or you don't drive a car, so you don't have, a driver's license, what are you going to attach it to? And are they going to be leaving some people out of this that now can't go to work because their employer is requiring that you to show a card and you don't have one? And maybe you can't afford to get one. So I think that there's a risk of creating some new disparities with such a thing. On the surface, it sounds like an exciting and great idea. And I've seen some really cool technology where it can be done on a phone. So you can show your passport when you go someplace. But, not everybody's going to be able to afford a smartphone either. So I think we have to think about this really carefully.
Now you're adding privacy concerns to the ethical concerns.
That is very true.
Well, probably not surprising. A lot of my colleagues in Congress are concerned about the use of technology, tracking people and all of the, different applications that might lead to. So that's, certainly on my mind as we look forward, hopefully to being able to move to the next phase of this. But, by no means we're not out of the woods yet. I mean, I still see our infection rate and our overall numbers they're not going down quite yet. They're leveling off, which is good in California. But it's obvious we still have a ways to go before we're out of the woods of the worst of this. Jenna in Orange County asks, protests are going on every weekend at the beaches by people who don't believe COVID-19 is real, who believe, and again, this is the question, this is not my comment, who believe it's a government hoax and who believe their civil liberties are being infringed upon. How do we prevent the spread of disease when so many people are not observing social distancing? I think the doctor said it extremely well before. Like the doctor, I'm a big believer in First Amendment rights, the right to protest and to express your views. That is fundamental to our American way of life and something that I will always fight to protect. I think at the same time, however, we ought to do all we can to try to maintain the health of our neighbors, and that health and well-being, whether we agree with them or disagree with them, is something that's extremely important, I think, to me and hopefully to everyone. And so I would just implore people, to the extent that they want to go out and protest, go out and protest, but please, to whatever extent you can, try to observe the recommendations of the CDC, and that means wear a mask, it means social distancing. And I think law enforcement has a tough balance that they're trying to figure out, which is protecting the right to free speech and the right to protest, while also ensuring the public health and safety of our communities. So it is a tough balance, but I think at the end of the day, I just hope that we can listen to the experts. That's a big reason why I have an expert on every week, hopefully to inform and educate a great number of people in our community to go out there or not go out there and just follow the best public health advice and scientific and data-driven advice that we can. Here's a question for Dr. Garfien. It came in from two people, from JJ in Dana Point and from John in Carlsbad. Among the most vocal of the anti-science protesters struggling with police at recent demonstrations are anti-vaxxers. They claim on social media to be just starting a conversation, but push conspiracy theories. They are well-funded and very active. Their reports with doctors' offices closed. Some children are missing their vaccinations. Could you please give your expert opinion on the safety of MMR vaccines and the importance of vaccinating a sufficient percentage of children to ensure herd immunity?
Oh, yeah, that's an important question. So when most of the population is immune to an infectious disease, it reduces the chances that someone with the infection will come in contact with someone who's susceptible to infection. In public health, we call this herd immunity. And measles, mumps, polio, and chickenpox are all examples of infectious diseases that were once very common in the United States, but are now rare because vaccines have helped us to establish this herd immunity. So I think that the idea that we can get there with coronavirus is also very possible once we have a vaccine and with people that are actually recovering from the disease. And I think that's something that we want to strive for. In terms of the vaccine itself, the MMR vaccine, measles, mumps, and rubella vaccine, is very safe. It causes at most mild problems such as slight fever, rash, some swollen glands in about 1 in 100 cases. It can cause a seizure due to the fever in about 1 in 3,000 cases or people who are immunized. And it only causes severe problems like an allergic reaction in 1 in a million children who are vaccinated. I know that there's a lot of concern about the safety of the vaccine and that there has been talk about it being associated with autism. And then so as of today, there's no reputable scientific study that has found a causal association between the MMR vaccine and autism. And I know that the anti-vaxxers like to refer to this one study that was published in The Lancet in 1998 that shows that there was an association between MMR and and autism. But as it turns out, the lead author on that paper was found to be guilty of falsifying his data. The paper has been retracted, and he was found guilty of professional misconduct. So that paper has been debunked, although it's still being used as evidence. So just to kind of give some background, the vaccination has been available since 1963, and the current version of the vaccine has been used since 1979 with a very, very good safety record. And so, the vaccine is highly effective. It's very safe. And because of it, we really don't see the measles, mumps, or rubella in this country anymore. One thing that is concerning, though, is that the CDC just recently reported that they have observed a substantial drop in childhood immunization since the national emergency was declared on March 13th. Social distancing will help for now to prevent people from being exposed while they're in their home. But once these kids get back out on the street, then they could be at risk. And so it's important that that children do get vaccinated. The routine schedule for the MMR is a dose at 12 months, between 12 and 15 months, and then another dose between 4 years and 6 years. So if you had to delay getting your child vaccinated because of the coronavirus, make sure that once you do have that opportunity, you get your child vaccinated. So talk to your healthcare provider about what kinds of arrangements they're making in your particular healthcare setting to get your children vaccinated. And then the other thing along that lines is the flu season's coming back around again. The flu can look a lot like coronavirus. It would be really nice if we didn't have to worry about both of them hitting us at the same time. So when the flu virus comes out, the flu vaccine comes out, I highly recommend that people get it. This will help to cut down on the burden on our healthcare system, and it'll help to preserve lives. The flu kills 40 to 60,000 people a year too, so we don't want to ignore that.
When is the flu shot ready to go?
It usually comes out sort of late fall. It depends on, from year to year.
It's like I just got the flu shot.
Time flies when you're having fun at home, right?
This year I'm ready, man. Sign me up.
All right.
Couple more questions. Ellen in Oceanside asks, Mike, a parent can claim a disabled child as a dependent regardless of the age of the child. However, the parent only gets a stimulus payment for a child under age 17. Does that mean that a disabled adult on SSDI over age 18 is not eligible to get a stimulus payment? This does not seem fair. Ellen, my understanding is you are right, both about the outcome of the CARES Act, where we left people out. Unfortunately, that was, I think, a huge oversight. The good news is we fixed it in the HEROES Act. So the bill that we sent to Mitch McConnell yesterday fixes that problem. And it basically says that dependent full-time children, students are eligible. And I'm hopeful that that'll be one of the things that's considered by the Senate as they move forward and they look to fix some of the problems with the CARES Act. Another question, this one's for you, Doctor. This is from Russ on Facebook. Ellen sent this one from our feed. Related to the one before, where we talked about the new syndrome we're seeing in children and the deaths in New York. It's been mentioned that the syndrome seen in children can result in permanent organ damage. Isn't this also occurring in some adults infected with COVID-19? Is it possible that we won't know the true mortality rate of this illness for years?
Yeah, I'm not a clinician, so I'm not seeing these cases myself, but I have been talking with some clinicians and I've been reading the articles. And what we're starting to see now more are people who have recovered from coronavirus, but they're just not quite bouncing back as quickly as we might expect. And that could be due to this response to the virus. One thing I understand is that the virus creates a very strong immune response, and that immune response can actually damage blood vessels and organs. Sometimes our bodies sort of overreact in an attempt to protect ourselves. And so the exact mechanism of that damage is being learned as doctors go along, and they're seeing more cases and they're figuring out how best to treat them. And as more information is learned about what's causing the pathology of this disease and what treatments work to prevent it, doctors will have a better ability to treat patients in a way that minimizes that sequelae. It's new, we're learning about it. And I think as cases occur and we recognize new presentations, just like with the multi-system organ failure with the children, we're going to start to recognize different conditions in adults and then start to look for more of them. And I'm sure they'll be presented. And then as we sort of accumulate cases, then studies can be done to figure out why those people had a different response than other people who didn't have that serious response. We can start to tease out what might be causing it and then how to prevent it.
Thank you for that. Another one from the Facebook feed from Susan. Why hasn't Wells Fargo been dropped from being able to grant these loans considering their recent bad behavior? Well, what's interesting about that, Susan, is that at the outset, when the CARES Act was passed, Wells Fargo, they're the largest small business lender in the United States, and they were not willing at the outset to do lending under the PPP, or very limited lending, because they said that because of the asset cap that had been imposed due to some of their malfeasance in 2017 and 2018, or years prior, as it was adjudicated, they had a mandated asset cap. And so they didn't want for the PPP loans to count against that asset cap. So they said they only wanted to do 10 billion in lending. And so that asset cap was actually raised to enable them to lend to more of their small business customers. They did begin doing that. And my understanding is that, like many of the larger banks, once they got a hold, or once they got a hand around the guidelines and understood the loan repayment provisions that SBA laid out in Treasury guidance on that they actually did do a better job. Now, what I've heard is that the smaller lenders, the small business lenders and community lenders have been the best in terms of the PPP lending. That's the anecdotal feedback that I've received from our small businesses. Thank you for the question. Another question from Barbara in Oceanside, and we'll make this the last one. The President said yesterday that schools should reopen, but that elderly teachers or staff or those with underlying conditions shouldn't go back yet. So would those employees, and the same at other businesses, qualify for disability insurance? Right now, if a business reopens and someone does not feel safe going back to work, they lose their unemployment insurance. Does Congress plan to address this? Barbara, I can tell you the answer is yes. In fact, we were having those discussions from a socially responsible distance yesterday as we were waiting for votes outside. Normally, we have those discussions, and there have been a lot of articles written about the importance of the in-person meetings of me and my colleagues in the House of Representatives. I am one that believes in the importance of the in-person discussions that we have. It's where a lot of work gets done, member to member. So I hope we don't lose that. Obviously, in the midst of a pandemic, we have to be very sensitive to the health concerns of some of my colleagues. But that was one of the discussions that we had is, we're going to be reopening schools in such a manner where certain people can't go back to those schools because of their age or because of their pre-existing health conditions. What do we do? And so I think those discussions are being had. And I think you'll be seeing at least the House, I can only speak for the House, but I think you'll be seeing the House take action this summer to help protect all those who work, not only in our schools, but in all those different professions on the front lines who do have those higher risk health conditions. So with that, Dr. Garfien, I am grateful to you as always. Outstanding questions from our viewers and great answers again. Do you have any final thoughts or concluding remarks for this week?
Well, I'd just like to remind everybody that testing and contact tracing is increasing. I know Mike's going to talk to Orange County and try to get that ramped up a little bit more too. So if you get a phone call from the county, please do respond. It might say, caller blocked or caller ID, but if they're trying to get a hold of you, it's all for good. Also, we're all trying to do our part. I know it's frustrating to be cooped up, and I know that there's businesses that are struggling, but I think rather than complaining about not being able to do what we want to do, we should all be thinking about how can we be part of that solution. We know how this virus is spread. We've learned a lot in this process, so we need to do our part to help to keep each other safe. And then the last thing I'd just like to say is we're talking about our Masters of Public Health program students, and I just want to send a shout out to Robert Wood, who's been really essential in helping me to do the research to make sure that I was able to give you the best answers on these calls. So thanks, Robert.
Excellent. Well, fantastic. Thank you so much, as always, Dr. Garfien, and I'm very grateful Want to thank all the leadership at UCSD. I know you guys are also leading on testing as well of your student body, and that's just fantastic. I've been reading and listening to a lot about that. I see my daughter is popping in. You want to say hello? Perfect timing. It's like she knows it's me. You want to say hi to everybody? This is Elizabeth, everybody. Well, I want to thank my wonderful staff. I want to thank my amazing wife, my two great kids for putting up with all this crazy congressional stuff. And thank you to Ellen Montanari for doing a great job answering all those questions. I am really hopeful that Mitch McConnell will get the hint from our mayors and our governors, whether they be Republicans or Democrats, and will do whatever he can to work with the Senate to get this aid for our cities over the finish line. It is so critically important. In the conversations that I've had, thank you, with our mayors, this is absolutely must-have funding or we're going to lose essential services. So it was critically important to me that we passed it in the House. We've now set that marker. We passed it in the House. The Senate needs to act. What do you think? Right? Yes. So thank you to my great team. Thank you for watching. And to my wonderful wife and kids, it's great to be back home. And I look forward to seeing you all again next week. Thanks again, everybody.